Independence Day, a time for delicious food, family, and fireworks. However, for some, fireworks can be a source of stress, especially for those who suffer from post-traumatic stress disorder. Dr. Sleep Sarani joins us live to continue our discussion. Once again, thank you so much for being with us this morning. Dr. Sarani, how can those with PTSD mentally prepare for planned events like national holidays?
Good morning, Barbie. One of the key thing is that PTSD reminds them of some of the events which has happened in the past, which is traumatic. The way to prevent is that, first of all, they need to train themselves. They need to know what things can trigger it. For example, in the fireworks, there is a loud noise and the frequent kind of a breaking noise, just like a gunfire. They need to mentally train themselves. They need to make sure that if there is a loud noise, they can actually wear the headphone that will muffle it. They can also like put some curtain around if the flashing of the light bothers them. They need to have the room well lighted. They need to have some family member around, so that can be a support system. So knowing and being aware is much important. I think the biggest challenge, which is sometimes you're sleeping at night at 2 in the morning and all of a sudden the firework noise comes out. That is something which triggers. So I think that is where the community need to be more cognizant of those factors.
Can PTSD happen to anyone?
One of the thing is that doesn't happen to anyone. A lot of the people can go through the same type of traumatic event, and our brain works very different. For example, PTSD is more common in women. It is much more common than what we thought. 10 out of 100 women can have a PTSD versus 4 out of 10 men. On an average, 7 to 8 people have it. It all depends on our genetic makeup. The women have a higher thing. Also, the people who probably can be having some of the mental illness history in the family, the substance abuse use, those are the factors which can increase the risk of having a PTSD.
And Dr. Sarani, what about children? Do they react differently than adults?
That is very true, that the children may not mask the four buckets which I just mentioned a little bit ago. The children can vary from, they become very distressed, they would not talk, they become isolated. On the other hand, some of the children can become very agitated, impulsive. Some of the children can manifest as a sleep disorder. They're very afraid to leave their parents. They start crying. They want to hold on to their parents. They're very afraid to go to the schools. They will start having some signs of somatization. So that becomes a very, very tricky diagnosis to make, because that can be confused with a lot of the other psychiatry conditions. So the patients and taking a good history and trying to slowly come and have the patient or the children express those things can help us in making a good diagnosis.
Are there effective ways to treat PTSD?
Yes, one of the things is that there are several effective ways to do that. So psychobehavioral therapy is one of the best therapy, and there are several techniques which we can use that. And some patient, if those techniques is not working, sometimes the medicine like SSRI and the other medication we can use to help them treat that.
Dr. Sarani, thank you so much for being with us. As always, we appreciate your time. If you have a question for Dr. Sarani, please send us a text, 361-855-6397.